Good afternoon, everyone, and we'd like to take this opportunity to welcome you to the Flint Community Webinar on Coronavirus. And yes, this is October 29th, and it is week 85 of this journey that we've been on since March of 2020. We are so excited that you joined us today. This webinar is sponsored by the Healthy Flint Research Coordinating Center, which is a community academic partnership along with the Flint Center for Health Equity Solutions and the Michigan Prevention Research Center. These partnerships are all designed to help make sure that when research is done in our community members are involved, are aware, and of course, keeping in mind how important your voice is. I'm excited to be your moderator today, Yvonne Lewis, as a co-director of the Healthy Flint Research Coordinating Center. It is extremely an honor to have had the privilege to represent our community at the American Public Health Association's annual conference. As we talk about this work that's being done here in Flint, we're able to share that 85, for these 85 weeks, these partners that you see on the screen here, for those of you that can't join us, I'll just give you a few. Every week for the last 85 weeks, a variety of these partners have been on this webinar to help bring relevant information to you during the pandemic that hopefully is helping you make some good decisions. The Genesee County Health Department is a regular participant along with the City of Flint. We have the Genesee Health System that is a part of our team today, Greater Flint Health Coalition, the Genesee Health Plan. We have representatives from of course, the HFRCC, and the list goes on. We are so thankful that these organizations representatives are available to answer questions for you every week. So we're going to ask you, if you have questions, please put those questions in the queue. We say the Q&A. So as we're going through the webinar today, your questions can be answered. We have an exciting conversation ready for you today. We'll be talking about COVID reinfections. The Genesee Health System will be talking to us today about their behavioral health urgent care. You're going to hear something dynamic from Dr. Susan Wolford during our medical moment. We'll hear again from the Genesee County Health Department and an update from the City of Flint. We want to let you know that this is a very, very important time of the year. This is October, we're ending October, but October has been Breast Cancer Awareness Month. We just want to take a moment with the pink. We just want to take a moment to encourage you, if you have not gotten your mammogram, and both men and women do need to be aware of breast cancer, but we also want to lift up any other opportunity that you have to get your screenings done, because prevention, we often hear that old saying that says an ounce of prevention is worth a pound of cure. And we hope that you will give heed to that. Many of us have family members or friends who have passed away from one form of cancer or another. And this is just an important thing for us to remember today. So just want to lift that up for you today. Today, we also want to remind you that you can contact Gary Jones. He is not able to be with us today. But he wants you to know that if you email him, he will make sure that you're on the list to get the updates from the governor's office. There's a number of initiatives that are happening that I think it's important for us to be aware of. So please email him at jonesg9@michigan.gov. And he says that catch-all website is michigan.gov/coronavirus. Today, we're going to ask our team to come forward for the roundtable. That's Dr. Debra Furr-Holden, Dr. Lawrence Reynolds. We're going to have Dr. Susan Wolford, and we also will have Kim Van Slyke, who's representing the health department as a part of our roundtable today. Last week, we started talking to you about family spread of coronavirus. And I've asked Dr. Debra, we missed you. We heard your voice last week, but we know you had some connection issues. So good to see you this afternoon. But Dr. Debra, we talked about this whole issue of family spread. And I think it's really important for us to really just get a better sense of what can we do to reduce spreading the virus among our family members.
Yeah, so I've been hearing countless cases of people who have been the sort of vector to bring the virus into a family. And even worse, reinfection within families. So it's important, right? We talked earlier in the pandemic about these pods. And I want to kind of give a bit of a caveat. If people are following the national news, what you'll notice is that nationally, COVID trends are trending downwards, right? As we start to get greater immunity out in community from people developing immunity through infection and recovery, and the, just major push in vaccination, we're seeing the national trend. That trend is not holding up in our county and in the city of Flint, and it's sort of not as strong in the state of Michigan. So, because people have asked me, well, what's happening here? Why are we sort of not? And I said, these are great questions. So it's important that people understand, think back to the Swiss cheese model, that model of pandemic defense. No one layer is perfect, but when you stack them all up together, they build this wall of protection. And I think people have taken the guard down on some of those important layers of protection. So I heard a story of a family where it was a student who went to school and the student contracted COVID at school. Now, younger age children oftentimes will be asymptomatic. Doesn't mean that they don't have it, and not all children are asymptomatic. I want to make that clear. But if the student is not masking, practicing good hand hygiene, being tested, and is at school, the chances of that student bringing COVID home to the family is increased. I love the thing that Dr. Reynolds encouraged us to do. And I'm assuming, at some point, maybe he was in a band. He strikes me as that kind of cool guy who might've played the guitar or something like that. He calls it cadence testing, right? It's like the rhythm, the beat of which you are being tested as a function of your exposure. So if you're being exposed, if you're going to work every day, if you're going to school every day, you need some regularity in testing, because oftentimes by the time people know they're COVID positive, they've already infected other people. So the only way to ensure that you're not doing that is to honor protocols when you're out, when you're indoors, to be masked, to not be in densely populated places, and to have some regularity with your testing. Because again, you could have COVID, not know it, and give it to others. And of course, what we really don't want is people who are at risk for severe symptoms or hospitalization or death contracting COVID. And that's what we're seeing with a lot of the family spread, is that younger, healthier people are exposing people in their family who are more at risk for severe COVID.
Thank you, Dr. Debra. And you mentioned something about Dr. Reynolds and the whole conversation about cadence testing. Now, earlier, he was just blowing my mind talking about this testing. And there's some questions, Dr. Reynolds, that we probably need to be asking about the testing that we're giving. So what recommendations can you give us with respect to testing? And then we want to go back again to talk about a little bit about reinfection.
I will repeat myself by saying vaccination is the foundation of prevention of infection, plus those layers that my colleagues talk about. We must have layers of protection. We still need to avoid crowded situations, large crowds with unmasked people, and that includes family members and people we consider close friends. We are responsible for protecting others as well as ourselves. Having said that, testing. You've heard me say a couple of weeks ago, whenever I fly out of town and I come back, I wait 3 to 5 days if I'm asymptomatic, and I've been asymptomatic. I wait 3 to 5 days and then I go get tested. I get a quick antigen test. And until I get that result, and that comes back in 1 to 3 hours, I do not go to see my 93-year-old mother. Now, I'm a senior myself, but she's more senior. I do that to protect someone whose immune system has been shown to be more vulnerable than someone who's 5 or 6 years old. But then to what Dr. Furr-Holden has said, if I'm around 5 or 6 year olds, they can be asymptomatic carriers. So I am really careful. So if I hear that one of them has become positive, or if I get symptomatic, I will go get tested. Now you're going to ask me what test? And that's
You're
not
right.
a subject I want to handle by myself, but Dr. Furr-Holden and Mary Catherine helped me this week with a simple chart where they talked test, the antigen test, and the antibody test. I'll start with the one that's least useful in the beginning, and that's the antibody test, because your body has to make enough antibodies for the test to be positive, and that may take days. Okay, so you may get there's different antibodies, IgM, IgG, IgA, and please just remember it takes days. You want a more sensitive test. That's where we get to the molecular test and perhaps the antigen test. The value of the antigen test is, remember I said I wait 3 to 5 days to get tested with that rapid test? By then, if I have the antigen, it should show up in the test, number one, or I may become symptomatic, number two. So a positive test plus symptoms means I have an infection. Okay. Now, if I have a negative test and I have symptoms, that may mean I need a more sensitive test. And that's where I'll go for the molecular test. And I say to my colleague, Dr. Wolford, anytime she's ready to jump in, jump in. Okay, so I may, if I have a negative antigen test, but I'm symptomatic, I at that point may ask for that molecular test. It takes 1 to 3 days, depending on how backed up the labs are and all the supplies that they have. But nonetheless, I would stay in isolation until I get that back. Okay. And then what if I get a positive molecular test now and we jump forward 3 weeks, I'm asymptomatic, been afebrile, and for whatever reason, I go get another molecular test. Here's where it gets a little rough. And not being a pathologist, not being an infectious disease specialist, what I have people who ask me, number one, did you get your test done by the same lab? Because different labs have different standards for what they will say is a positive test. A molecular test is so sensitive, it will pick up non-viable pieces of the virus. And so if you keep getting a positive test, there is another level of test that's not done routinely. You have to go see U of M for that, and that's assessing viral load. And once again, I say to Dr. Wolford, jump in anytime you wish. But so, you know, and I said half jokingly to folks when I talked about this earlier, we're talking about science, okay? Science is not religion. Science is a process where we improve what we know every time. This is our first pandemic in 100 years. We know about. This is our first experience with this virus. And what we learn today will change what we say tomorrow in order to protect each other. Now, some people say, you all can never make up your minds. No, we are always in a process of protecting our community and ourselves. So,
I see Dr. Wolford's come off of her, opened up her mic, so she's going to help you out. So
No, I just wanted to say amen. I know it's not religious, but I want to say amen. I agree with everything that has been said. And I think when we get to those tricky areas, that's when you work out things with your physician, right? That's when it's important to have a healthcare provider who you can discuss these things with. But certainly the testing, as Dr. Reynolds described, is what we want to do. And I want to say that I think about this like the weather report, that we have to, you can't look at the weather report today and believe that it'll be the same tomorrow or the next day. You have to keep checking and use the information that you're finding out, because there'll be new information. Use that to help you make decisions.
Thank you, Dr. Debra. As you say, you're the science lady and the numbers lady and the epi lady. Tell us how to integrate all of this.
Well, I want to underscore this notion around testing. I do think Early on in the pandemic, we had a sort of problem with testing. We didn't have a lot of testing available in the community. We were only testing symptomatic people, et cetera. And we realized that that was not sufficient to sort of get this thing under control. Only testing or only getting the test if you have symptoms will not serve you, and it won't serve the people around you. Why? Because oftentimes by the time you have symptoms, you have infected other people, unbeknownst to you and likely unbeknownst to them. When we look at it, and when we get to that section, I'll show you our testing rate, our community positivity rate. That's of the people who are getting tested, how many are positive. That number is going up. And I actually think it's going up slightly as an artifact of people aren't getting tested with some regularity. They're only getting tested when they think they have been exposed or if they think they have COVID. The majority of people, not everybody. And so it's very important. These, rapidly being able to identify somebody as a case, that person getting themselves into isolation, getting others out of harm's way, getting themselves, the sort of care and rest that they need. This is just so critically important. And I love what Dr. Reynolds said, that vaccination, we've got to do that. I look at places like California and some of the experiences that they're having. I read this really great article about an overnight summer camp where they had, it was multiple camps that they looked at, and there were thousands of people that participated in this like month-long overnight summer camps. And they only had 9 COVID cases. And those COVID cases caused no secondary infections because they had everybody test before they came. You had to have a negative test within 3 days. And then nobody, once the camp started, it was locked and loaded. And then they tested every single human being, every counselor, every participant, every staff person for 12 consecutive days so that they could ensure that they did not, and they kept the campers in small little pods until the end of that 12th day, where they could then integrate everybody once they knew, like we know that all of these people are negative. So as I start to think about, man, I wish we would all sort of apply that kind of thinking. We've got some good science and knowledge about how to prevent and reduce the spread of infection. We just often don't apply it because it's not convenient. And this is not a thing where we want to succumb to convenience. We want to really use the science. So like Dr. Reynolds said, when he travels, he comes back, he kind of quarantines himself. He gets a test a few days after he gets back, so he knows that he's had enough time to build up enough viral load to test positive if in fact he is. That's just following the science. So, I'm happy that we can keep having these conversations so that people understand what the good science is and how to then apply it in their life and be a champion for others to apply it as well.
Thank you, Dr. Debra. I think that's so important. I just want to ask again, just to be sure that we're clear on the reinfection piece. Did we miss something when we were talking a little bit earlier about this that you wanted to share?
People often have this myth that once you contracted COVID, you're good. And that's just simply not the case. And we know, and I won't, say names, but I've talked to many people in our city who have had 2 COVID infections within 6 months, right? So you do get some protection when you are infected and recover, but it doesn't make you immune. Even worse, all of the reinfection cases that I've spoken to personally said that their second infection was worse than their first infection. So even if you were infected or somebody who was infected, you should still get vaccinated. The vaccine, and it's funny, this is what they're telling us, that people who have recovered and have gotten vaccinated tend to have the most robust immune response to future infection. And they tend to have lots of antibodies and all these, all of these other parts of our immune system that kicks in to help us fight off infection. So reinfection is possible. Reinfection can, in many cases, be worse than an initial infection. And the best way to prevent that is to get vaccinated and continue to practice prevention.
And Dr. Reynolds has something else he wants to add to what you just said.
Well, there's not much I can add to it, but it goes back to where we started at the beginning. We get vaccinated and we do all these prevention activities to protect people about whose immune status we know nothing. And we do know from natural infection, the antibody levels drop off. And that's why we get that booster, more bang for our buck. And that's why we're talking about giving immune compromised people a fourth booster. And for some conditions, remember, there's a virus that causes the common cold, which is a coronavirus. If we got one cold when we were 3 years old and we never got another cold again, that would mean that natural immunity works perfectly, but the virus changes. And so, in order to protect ourselves against these variants and new strains, even though they're from the same family, they can cause a reinfection.
Thank you. All right. Now I see Dr. Deborah, Dr. Wolford, you're going to have another opportunity because you're going to come back and talk to us about boosters. Want to give you one last opportunity, Dr. Deborah, if there is something you want to add here, and then I want to jump over to Kim Van Slyke right quick.
Yeah, my last push for folks is that we were doing better in the pandemic, and then the Delta variant emerged. And I found out from somebody who runs like a leading state lab here in Michigan, like 99% of our COVID cases are Delta cases, right? We had other variants. Now they got this Delta plus variant, but the Delta variant specifically seems to just be much more transmissible and makes people sicker. And it really just took hold. We gotta not let this virus continue to outpace us. The longer people delay in getting vaccinated or getting their booster, if they're booster eligible, all it would take is for one more variant to emerge that does what Delta does, that is even more transmissible than Delta or causes more illness. And we could be right back in the throes of a really, sort of ugly part of this pandemic where we have been before. The best thing that people can do, it's like, and I understand people have so many questions. We are now, there have been places where there's a scarcity conversation around the monoclonal antibodies, which is one of the therapeutics. And NIH has come out with some recommendations on how to prioritize people for who gets monoclonal antibodies. And oftentimes those decisions will reside with the care provider. When people get sick from COVID, and all the people that I know who've contracted this that were unvaccinated, most of them regretted that decision. And once they were sick, they wanted any life-saving medication that was available to them to be available to them. I just want to caution people, whatever your concerns are, your fear around the COVID vaccine, be forewarned. Contracting COVID will be way worse than any consequence you could have from getting vaccinated. And once you contracted COVID, it's one of those things, you can't unring that bell. So I just encourage people, let's stay ahead of this. Let's bring this to a close. And our best effort there is going to be vaccination and prevention. And I tell people all the time, I believe the vaccine is safe and effective. Based on everything that I know, everything that we know now, the vaccine is safe and effective. The big concern that people have, well, how will we know 10 years later that it wasn't a problem? The reality of it is we won't know, but science tells us and history tells us if vaccines were going to be problematic, you will know within immediately after getting that shot, or typically within the next week or two, if you were going to have some negative or adverse event. The likelihood that there's some 10-year down the line effect from a vaccine is so extremely rare. It's not a big enough risk to, I think, counterbalance the tremendous benefits of getting vaccinated right now, since we are still very much in the throes of this pandemic.
Thank you, Dr. Debra. And before we go, panel, there is a question in the queue because sometimes we want to make sure that things are clear. What is antigen? Why that test? And if you can explain the asymptomatic, just so that all of our listeners can hear those responses. Dr. Deborah, you take it.
What is the antigen? What is the antigen?
Yes, what is the antigen?
So antigens are proteins on the outside of the virus. Remember that we showed that if you look at the skin of the apple or the stalk of the apple, the outside of the virus, that's what the antigen is. And that's what those quick rapid tests are looking for. The other genetic tests look at the inside, like the seed of the apple, to look for the genetic material. So that's the difference between the antigen test and the PCR that looks for the genetic material in the middle.
Thank you. And Dr. Deborah, can you take on the asymptomatic question? What is asymptomatic?
So asymptomatic are people who are positive but don't have symptoms. So it's, I think that's Latin A, like they're without symptoms, but it doesn't mean that you cannot still infect others. So asymptomatic is just people who have the disease but don't have symptoms.
And I'm going to take an effort at this. I think it's afebrile. One of the terms that was also used. Yes,
without a fever.
Without a fever. Okay, so that we don't have symptoms and we don't have a fever, but we still could be infected and infect others.
Right. And the question as to why you would get an antigen versus another test, the antigen one, because you're looking at the outside, is very quick, easy, and cheap. That's why you would do the antigen test as opposed to the others that take longer.
Dr. Reynolds.
Yes, and you can have the infection without having the disease. And that's what we mean when we say asymptomatic. You can have the infection, you can spread it to other people, but you may not have the disease or any symptoms. You're walking around and everything's fine. So those are things to keep in mind all the time.
Thank you so much. Now we are going to ask you to keep putting those questions in the queue. Our panel will be ready to answer them for you and come back next week. We're going to have more information to share with you. Thank you to Dr. Reynolds, to Dr. Wolford, and to Dr. Debra Furr-Holden. The question has been asked about some additional mental health services available in our community. Jen, or we call her Jen, but Jennifer McCarty, who is from Genesee Health Systems, will give us a clear update on what's happening with a new opportunity here in our community for behavioral health urgent care. Good afternoon, Jen.
Hi, thank you so much for having me. Really happy to be here and be able to share this really valuable resource for our community. So if you think back during the pandemic when everything was really shut down and nobody was going anywhere, people needed extra support. And so during that time, GHS launched a all virtual behavioral health urgent care service. And that was for people to have video chat-based supportive chat option, as well as a full crisis assessment via video chat. So now what's happened is we have recently, as of October 4th, opened an actual physical site because we know not everybody has the capability or technology to access a video chat only service. And so our goal is to provide 24/7, 365-day a year opportunity for people who need support. So with this service, we want people to get connected to the care that they need, have the support that they need, and hopefully prevent any unnecessary trips to the emergency room and have decreased inpatient admissions if that is appropriate for them. So that the hope is to reach people sooner before it gets to that point, right? And so we also want decreased incarcerations related to mental health concerns, because we know the sooner people get assistance and support, the less likely things are to escalate. And so next slide, please. Let's take a look at what somebody needs to know about our new behavioral health urgent care center. So the virtual service continues with licensed mental health professionals 24 hours a day, 7 days a week, 365 days a year. We now have on-site services available on a walk-in basis, Monday through Friday, 8 a.m. to 10:30 p.m. So we're outside of traditional business hours. We know people need support outside of a traditional business day. And so those licensed mental health professionals are available for people. We want this service to be accessible to everybody. So it's open regardless of someone's insurance coverage or ability to pay. It doesn't matter if you have private insurance. This service is for no cost to you. We're able to do this through a combination of grants that we can offer. If people do have insurance, we do ask for that information because we do need to bill insurances and seek reimbursement that way first if it's available. But anything that's left is covered by our grants. And so we're really lucky to be able to bring this opportunity to our community with that grant funding. And a little bit later, I'll also talk about some sustained funding that we have and some feedback we want to hear from the community on that. So now the in-person services are targeted towards people with urgent needs. If you need someone to talk with, crisis intervention, or pre-admission screening. And for people who don't know, Pre-admission screening really is just a long way of saying, we're going to talk with you, find out how you're doing now, and look at what services we might need to link you to right now today, and then authorize those services for you and get you set up to go to those, next providers. We also can link people to regular outpatient or ongoing care that's not urgent to that day, and also linking to resources. People come in and they don't have food, they don't have safe water to drink, we'll help get you linked to those resources. So we also see people who have COVID-related distress. What that means is people who might be essential workers, or people who have to wear a mask all day, people interacting with the general public, or people who are actually infected with COVID. That's a really tough thing to do. And so we are there to provide kind of some specialized support to people who have those type of concerns going on. Anyone with mild or moderate mental health symptoms, you don't have to be in an active crisis to come in and talk with us. We want to reach people where they're at before things become a crisis. But if things do become severe, we're also here to help and can provide the support that somebody needs at that juncture as well. Next slide, please. So let's talk a little bit about what the services actually look like. So somebody walks in, they check in at our front desk, and the first step is really to have a listening ear to do some supportive problem solving for what's going on. We look at support for healthcare professionals or essential workers with that COVID-related distress as well. That is confidential support. A person does not have to be currently receiving any other mental health treatment in order to come in and meet with us and talk with us. And we also help assist people with accessing those community resources, like I mentioned. Now, one unique thing about the services provided from our site is we do provide video chat-based support, not just to the general public all the time, but also to law enforcement officers. Law enforcement officers out in the field can have video chat-based rapid assessment and triage. So if they come upon somebody who's having some sort of mental health related issue, they can get in touch with us and we can have that video chat session right there out in the community and get that person linked to the treatment or support that they need. And also, now that we have a physical site, there's a place for people to go outside of an emergency room or the jail where they can come and talk with us in a location. Because if anyone's been to the emergency rooms lately, they are busy and they have a lot of things to do. And a behavioral health emergency or behavioral health situation doesn't always need real intensive level of intervention like a jail setting or an emergency room. So if somebody is having a full crisis screening assessment, in other words, they might need services right there that day at that moment before any other outpatient care can happen. The types of services that they might authorize for would include crisis stabilization or intensive crisis stabilization services. What that means is people might need a mobile team to come out to where they're at. For example, for on a video chat call, people might need a mobile team to come out to them right then. We also authorize services for something called crisis residential unit. And a crisis residential unit is essentially, it's an unlocked place where people can go who might need some support and monitoring from professional staff. They might also still need to see that psychiatrist, but they don't need to be in an inpatient locked facility. And that can happen in a lesser intensive environment. We can authorize for inpatient psychiatric hospitalization and get people connected to that care as well. And we also have partial hospitalization programs, which means that you might actually go to a hospital-like setting, but it's just during the daytime. Next slide, please. So referrals to this service. Anybody can make a referral, but a referral is not actually required prior to being seen. So it's not uncommon for us to get a call from a provider out in the community or a community partner and say, hey, I've got this person here, they're not doing so great. This is what's happening, can you see them? The answer is, if it's during the walk-in hours, yes, they can walk in anytime between 8 a.m. and 10:30 p.m. And any behavioral health and healthcare providers even if they can make a referral or want to call and give us a heads up about what's going on, generally what we're going to do for that person is assume that they've already been through their care team, and that care team feels like, you know, this is bigger than what we can manage. And so we're going to do that pre-admission screening and look, do they need any emergent or urgent services right now today? So one limitation of this service is that a third-party referral can't be accepted on behalf of another person. So in other words, the person who is going to need the service has to be there, whether it's a video chat session or in person. We can't do a whole lot if that person isn't willing or open to come in and see us at that moment. There are some other alternatives for those situations that we can link a person to, but right there at the urgent care, a person does need to be interested in that service. Of note for minors, anyone over the age of 14, so between 14 and 17, they can access this service without an adult, like a parent or guardian present. We do still try to engage parents and guardians, but the Michigan Mental Health Code says they can access that service without an adult. But if they're referred to any ongoing service, like an inpatient stay, we do have to have a parent or guardian consent for that. Next slide, please. So some of the most common reasons people come to us is the mental health crisis, substance abuse issue, COVID-19 related distress, maybe someone's isolating or quarantining, it's really lonely sometimes, depression, anxiety, panic attacks, suicidal thoughts or other disturbing thoughts. Next slide, please. And somebody can get connected by either walking in for our services, 8 a.m. to 10:30 p.m. We're located at 422 4th Ave, right in downtown Flint. The cross streets are 4th Ave and Grand Traverse. And so we share a parking lot with the Genesee Community Health Center, and also are right across the street from Genesee Health System as well, and kind of kitty corner to Hurley right there. Another way people can get connected is by calling the phone number you see on the slide, 810-496-5500. That rings 24 hours a day, 7 days a week, 365 days a year to our program. If it's during the program hours, you'll talk to our front desk. After hours, you will get an answering service that's specially trained to help you get connected to our staff directly through the video chat service, because there are a few steps a person has to take. They have to get their device hooked up. They have to have a device with video chat and microphone capabilities. And so as long as they have that, we can help get them connected up. Next slide. So as I mentioned, here's a few of the options. The main thing, somebody has to have a camera, microphone, and internet access. Now, it's a fairly simple process. No one has to download an app, create an account, or select a password. Essentially, we text message or email that person a secure link. We use a HIPAA compliant platform called Mend, and that platform allows us to send that link. The person clicks on the link, they say yes to sharing their microphone and their video capabilities with us, and then they can get started right away. So thank you for allowing me to be here, share this resource with you, to our community. We're really excited to continue to expand this service. This is the start for us, and we're hoping to continue to expand our services. As I mentioned at the beginning, an important thing is that our funding is time limited right now. We're piecing together grants for people who don't otherwise have insurance that will reimburse us for those services. And so one of the more sustained funding sources we have that's going to help us continue to grow and expand this service, as well as other services with Genesee Health System, is the mental health millage. It was passed back in May, and we are holding community forums to get the community's feedback on what we can do to help meet the community's needs with this millage money. So we need to hear from you. There are 3 in-person community forums. One is in Clio on Wednesday, November 3rd from 6:30 to 8. There's another one on Wednesday, November 10th from 6:30 to 8 in Grand Blanc. And there's a third one on Wednesday, November 17th. That one is in Flint, downtown, 6:30 to 8 p.m. And this flyer will be available to be sent out to anybody who needs or wants to see it. You'll also see it on our Genesee Health System Facebook page. And then there's a virtual event on Thursday, November 18th, for people who don't want to join in person, and they can join the virtual event. Give us your feedback on how you think we can best spend that money to meet the community's needs, because we can't do this alone. We need to know what support the community needs from us. So well, thank you for having me.
Yeah. Thank you so much, Jen. We appreciate you being able to come on. And just want to remind that the location is 422 4th Street.
Yes.
Is that correct? And 4th Avenue. All right.
Yeah.
Thank you so much, Jen. And we're going to move quickly and look forward to more information. Sherelle is going to give us an update from the Genesee County Health Department. And while you're coming, Sherelle, quick question for Kim Van Slyke. Didn't get a chance to ask her this during the roundtable, but Kim, there are some things that the health department is doing with respect to children's vaccines. There's a waiting for some information to come from the state. Can you just help us to understand, because there are some people who are expecting to really get that opportunity for their children, but you're waiting on some information from the state. Is that correct?
Yep, absolutely. Good to see you, Yvonne. Thanks for having me today. So just like all of the rest of the stages of the vaccine, it starts at the top. We wait for the FDA approval. It goes through a committee that specializes in vaccine recommendations. They vote on it. They give us their guidelines. Those are published. That goes to the state level. The state reviews it, MDHHS reviews it, MDHHS puts out their guidelines, which then comes down to the local level. From what we are hearing and from the history that we have seen during the rest of the vaccine rollout stages, we are hearing that those meetings and voting levels are going to start taking place next week. The second and the third are the rumors that I'm hearing, which if everything gets voted through, then we will see information from MDHHS Friday or Saturday. After we get the information from MDHHS, we then have to incorporate that into our own policy and print new papers with those policies in them and have a new policy signed, standing orders signed, so that we can actually give and administer the vaccines. So we are hoping, fingers crossed, with the timeline that they're talking about, and like I said, the experience that we've had in the past, to be able to roll out pediatric vaccines starting the week of November 8th. So we are in process right now with making plans for planning pod sites again around the county, so that we can do outreach throughout the county. We will continue to hold our 3 faith-based clinics through that time as well.
Thank you, Kim. And that just leads us right into Sherelle, because when you get that information, it'll be a part of her report. So Sherelle, help us to understand quickly what's happening this week.
Well, good afternoon to all. This week, we did introduce the booster dose for all 3 vaccines, Pfizer, Moderna, and Johnson & Johnson, and we have seen a pretty good turnout. Right now, just about 360,000 individuals within the Genesee County population have received at least 1 dose of the vaccine. 47.1% of our population is fully vaccinated, which is awesome. That means we're almost halfway there. Next slide. But I do want to let everyone know that our trend of new COVID-19 cases have decreased, but we are still in high transmission. So for every 100,000 individuals within the community, a certain amount have tested positive for COVID. So we want to encourage everyone who's received their first and second dose, if it's been 6 months, to get your booster dose. And then those who have a suppressed immune system, you are eligible for a 3rd dose of either Moderna or Pfizer. And 6 months after that 3rd dose, you can receive the booster dose as well. Vaccines are interchangeable, so no matter what you started with, if you want to change it for your booster dose, you can do that. So if you got Pfizer, you want to switch to Moderna, you can do that. If you receive Johnson & Johnson, you can get Pfizer or Moderna. The choice is now yours. Next slide. So we want to see the positivity rates go down in Genesee County. Right now, our positivity rate is at 15.1%. So that's pretty high. And ways that we can do that is to continue wearing our masks, avoiding those crowds, and of course, coming out to the clinics to get your vaccine. We have our 3 clinics every week that are provided through Genesee County Health Department. On Tuesdays, we're at Our Lady of Guadalupe from 12 p.m. to 2 p.m. and we have Moderna and Pfizer at that clinic. Wednesday, we're at Central Church of the Nazarene from 10 to 12, and there you can receive any of the 3 vaccines. We keep those available. And then Thursdays, for those who aren't able to come to an earlier clinic in the day, from 3 to 6 p.m., we're at Shiloh Missionary Baptist Church, and there we're able to administer vaccines to all. And like Kim said, soon we'll be able to provide vaccines for our children who are 5 and up. So we expect to see our community out in high numbers to stay COVID-19 free. And in order to get some testing, which is free in Genesee County, I have posted some sites on this slide that you can visit: Word of Life Church, Bethel United Methodist Church, as well as Macedonia Baptist Church. All 3 of those sites have COVID testing where you can receive a rapid antigen test or a PCR test if you ask for that. These 3 sites also offer the Pfizer vaccine. So you can visit one of those sites to be tested and vaccinated as well. And then we have our local Walgreens and Rite Aids, of course, and Hamilton Community Health Network. If you visit Genesee County Health Department's website at gchd.us, you'll get a listing of addresses for all the Rite Aids and Walgreens that we have available to the community. And then last but not least, I want to let you all know that we are servicing our homebound residents. So if you have anyone who can't make it to the clinic or leave the house, we ask that you give Genesee County a call, Genesee County Health Department a call at 810-344-4800, or visit our website at www.gchd.us/vaccine scheduler/.
Thank you, Sherelle. A lot going on and more to come. You mentioned in your presentation something that Dr. Wolford is going to talk to us about, and that's a little bit more about the boosters. Dr. Wolford.
Thank you so much, Yvonne, for that this opportunity to speak a little bit more about boosters. And so if you just, there we go, you can just spotlight me briefly. We've talked about boosters before, and we know that to do with vaccines, whether it's the original vaccine or whether it's the booster, a lot of it is to do with the spike protein, right? So I want us to imagine that this little fat sopping brush that I bought for my kitchen is the spike protein, right? And you see how it's made up of lots of different parts. That's what the spike protein is like. It's made up of different parts. And you see how it can sort of change shapes. I can get it to come in and cover up those end parts, or I can let it come out partly or all the way. That's what the spike protein can do. And I want you to hold that in mind while we think about how boosters work and whether or not we should get one. Okay, so as you will recall, hopefully you can see my slides there, the vaccines work by causing our bodies, our cells, to make a form of the spike protein so that we can learn to make antibodies that fit onto it, and we can train our T cells and other immune cells to recognize the spike protein and recognize it as a problem and go ahead and kill any cell that has that spike protein on it. So what do boosters do? Well, what they do is they help us produce even more antibodies to the spike. But not only does it end up with us getting more antibodies, those antibodies fit better to the spike because of the process called maturation, but they help it to fit better to that spike. And then they also produce more cells that have a memory of what that spike looks like, so that when we come in contact with COVID, we are ready to go ahead and kill the virus so that we don't get sick. So really great things that the booster does. And how does it do it? We know that it does it by causing these 3 different steps to occur. And many people have asked, well, do you have to have the same booster shot as you had beforehand? And what we've been told is that you don't. That indeed, if you had the Pfizer before, you can have the Moderna after, or vice versa. And if you've had the Johnson & Johnson, you can definitely have one of the mRNA vaccines after. And so why is it that this mix and match works? Well, there are probably many reasons, but one possible reason is that, remember, we have this spike protein. It's all about teaching us how to recognize that spike protein. And we've often displayed it this way, showing different parts to it. And it really is a very complex looking molecule, a complex looking spike. And it's made up of lots of different parts, as I tried to show you with my little fat brush here. And it changes shape sometimes. And so what our body does is the vaccine, it allows us to have kind of a wanted poster to show a picture of this spike protein in one of its forms to our body to be able to recognize it. And possibly different vaccines might show a slightly different image version of the spike so that our bodies get used to seeing it in a few different ways, slightly different ways, so that now it really can recognize it very well the next time that one comes in contact with it. So not to be afraid of getting a mix and match. And at the moment, we don't have enough evidence to say whether mix and match is definitely better than getting the same one again. They all seem to work well to do the 3 things I mentioned before: improve more, provide more antibodies, and act to bind more strongly to the spike, and get those cells, more of those memory cells. So whichever one of those mRNA vaccines you get for your booster, go ahead and take it. It will be fine. Now, why do we need to might we need to get a booster? And we've gone over this before. If that green range is the good immunity, then when we get the first shot, it gets us up into that good range for immunity. The second shot gets us even higher into that range. And then we are now getting in the data to tell us about whether or not it actually, that level of immunity decreases. And in the first 2 shots, you get the same thing. And in the third shot, there's a question as to what could be in it. And so far, Pfizer is giving the same thing as the first 2 shots, and Moderna is given half the dose because they were able to show in their studies that if you got half a dose, you still got the same kind of boost in your immunity. And so this is why we might need to get a booster, and this is what might be in that booster. And just to say a really important point about efficacy, that immunity and that efficacy, those 85% and 95%, those numbers, against what? Well, we've talked about this a little bit. When we think about COVID, it's on a spectrum from not having COVID, being protected so you do not get it, to where you get it, but you don't have any symptoms, to having mild symptoms, moderate symptoms, severe symptoms, and of course, unfortunately, death. So when the vaccines first came out, we knew that people were well protected against all of these things, from mild to moderate to severe. We didn't know for most of them whether it protected against no symptoms or no COVID, because it didn't, the studies were not set up that way, but we knew it protected against everything from mild all the way to death. As time progresses, it's clear that it is waning, maybe for the mild and the moderate, but we are still very well protected against severe cases and death. That really shows that vaccines work. They work. The messaging should be clear. They work. But because we want to still be protected against mild and moderate, when we weigh the pros and cons, it heavily goes towards the pros. If you get a booster, your personal protection increases against the mild and moderate. You avoid getting long haulers because you're not likely to get the disease. You protect others who can't get the vaccine, which all gives you peace of mind and allows you to visit your 93-year-old mother, and all of this at very limited risk. On the con side, there's very few cons. Possibly it's more expensive, but that's still something that's up for question, because it's very expensive for people to get sick and have to be treated. So clearly the evidence at the moment weighs towards getting the booster to help protect you against all degrees of illness, of sickness from COVID.
Thank you, Dr. Wolford. And hopefully that does answer some of the questions people had about why the boosters and why the mix. We're really close on time today. So Lottie, can you give us those 1 or 2 top items for the city today?
Absolutely. I'll be super quick with a fun update. I'll let folks know that the city of Flint is welcoming trick-or-treating this year on Sunday. From 4:30 to 7 p.m. We're asking that people follow CDC guidelines around trick-or-treating, stick to outdoor activities, limit exposure, don't use Halloween to widen your social circle, stick to the folks that you've been hanging out with right now. Wash before wear. If you're going to go out in costume and you're going to go out and do a couple different activities, wash your mask before you put them back on. Map it out, make sure that you know where kids are going and where they've been. Don't participate if you're sick, wear a mask, use social distancing, and if you are giving candy out, consider a no-touch method such as a table or a tube rather than giving candy out through your doorway. Happy Halloween and go blue.
Thank you. Thank you so much, Lottie. Dr. Deborah, in these next 2.5 minutes, I know there's a lot of information in the policy brief today. What say ye about the policy brief?
I didn't have to have a lot of blue in my life today. Go blue, only because I love Lottie Ferguson. All right, guys, here's the short version. The trends, it looks like, you look at that Genesee County graph, it looked it dipped down, but we'll have to wait till next week. Why? Because we know more cases will come in, more probable cases will come in, and what we call lag cases. So cases that are actually counted this week, but the result didn't come in this week, so they don't get counted. We add them next week and we put them in as that gray line. Clearly in the city of Flint, if you look at the top of the red line, we've had a slight uptick in cases. Guys, stay the course, get vaccinated, get those boosters, practice prevention. That's really, I think, the most important thing that I want to stress for people. The numbers are not following the national trend here, so people stay the course. And I'll stop there for the sake of time.
Thank you. Mary Catherine, what's the top thing you want us to know?
So there's really, so we're definitely out of time, but we're really excited about this package of bipartisan legislation to get clean water into schools and childcare facilities.
And so please get the policy brief and you will learn all about that. Please contact Mary Catherine. She'll be happy to make sure you get on the list for the updates for the policy brief. We are so thankful that you joined us today and excited about all the wonderful information. Social workers and community health workers, please fill out the form to get your contact hours. And I just want to let everybody know how powerful this social connected opportunity is for us. We're able to help others get involved by you sharing the information. So we want to ask you to stay connected with us. Like us on Facebook, subscribe to the YouTube channel, Healthy Flint. Email us with any questions or for more information at info@hfrcc.org. And as always, please give us a call at 810-835-2130, and we'll be happy to respond to your questions. That helps us to prepare for each week. And so we look forward again to seeing you next week at the Healthy Flint Research Coordinating Center's Flint Community Webinar on Coronavirus.